Assalamualaikum and good morning to one and all. Today we'll study about part 5 of adverse drug reaction. I am Sheikh Abu Sufyan. I welcome you to my YouTube channel Pharma Learning Forever. At the end of this e-learning session, you are able to explain best practices in adverse drug reaction reporting and sample ADR reporting form, discuss role of pharmacist in preventing adverse drug reaction. So let's start with the first topic outcome, that is best practices for reporting of adverse drug reaction. As far as ADR are concerned, the ADR and medication error should be reported immediately to the physician. So this must be the practice for reporting of adverse drug reaction, because generally patient they suffer from the ADR, and if patient is not reporting that to the physician, how come physician will report to the next level of the authority? So when as a pharmacist or as a physician, when you are prescribing the medicine, or as a pharmacist when you dispense the medicine, at that time you must counsel that patient and inform that if you are suffering from any sign and symptom of adverse drug reaction or any unusual sign and symptom, then in that case you must immediately report to the physician. Now patient has reported to the physician. Now it's responsibility of the hospital or the physician who is working in that particular hospital to report any unexpected adverse drug reaction which was seen with the patient to the FDA, medical association and manufacturer for further action. Because we have seen the sum of the ADRs are directly related to the manufacturer. We have seen very good example of the phenytoin. When you have just changed one excipient of the phenytoin capsule, the patient suffer from more toxicity to the phenytoin. So you need to also report to the manufacturer in order to avoid further exposure of the patient to the drug and drug related adverse drug reaction. So this must be the best practice. So the patient must report immediately to the physician, and hospitals are encouraged to report any unexpected adverse drug reaction to the FDA, medical association and manufacturer. So several practical approaches can be initiated in the hospital setting to increase effectiveness of detecting and reporting adverse drug reaction. Now what could be these practices? So the first practice, it is retrospective surveillance. So when new medicine, if it is given to the patient, then in that case, for that medicine, we have seen generally you put inverted triangle. So that is the best practice to know that the medicine, it is the new medicine in the market, and that inverted triangle, it is kept for at least 2 years. Okay. So now whenever any medicine or which having the label with inverted triangle, that indicate that this is the new medicine which is under surveillance, which is under post marketing surveillance, and those medicine must be strictly supervised by the physician as well as the pharmacist. So for the first person who is coming to the picture, it is the physician, and rarely patient report to the pharmacist. So there could be two type of surveillance you can conduct. First one, it is retrospective surveillance, where what you are doing, if the patient suffer from the ADR, then you just study their history. So when you look back into whatever happened to the patient, and if that type of surveillance if you are conducting, that is called as retrospective surveillance. So you are going back, you are doing the introspection about what medication were taken by the patient, what were the other medicine taken by the patient, what was the food he has taken along with the medication, to predict adverse drug reaction, whether it is purely related to the drug, whether it is related to drug-drug interaction, or it is related to drug and food interaction. Likewise, many interaction could be possible, like drug and smoke interaction also, right? So once ADR it is reported to the physician, then physician can go back and study the history of the patient maybe for 5 to 10 days, that what patient is taking along with the medicine and at what dose he is taking. So he can study entire history to detect adverse drug reaction. So this type of surveillance, it is called as retrospective surveillance. So basically you are going back, you are looking back into the events of adverse drug reaction. Second surveillance, it is active surveillance. So generally active surveillance, it is compulsory for those medicine which are newly marketed or which are newly launched into the market. So in active surveillance, what you are doing, you are not going back into the history, but when patient taking the medicine in the hospital, you are supervising that patient, right? And you are trying to guess or you are trying to recognize any potential adverse drug reaction which is related to the drug. So if on day-to-day basis, if you are conducting the survey, it is called as active surveillance. So the regular surveillance, it is active surveillance, whereas when already event is happened, already adverse drug reaction is happens, and then you are going back into the different event of the ADR, that is called as retrospective surveillance. So these two practical approaches can be initiated in the hospital setting to increase effectiveness of detecting and reporting of adverse drug reaction. I hope you understood about these two important practical approaches. In addition to this, there are various methods of reporting can be designed by individual pharmacists and institutions for their use. We have seen in case of the reporting of adverse drug reaction, there were four methods like spontaneous method of reporting, then patient direct reporting, case study and case publication, and we have also seen about a yellow card system. In addition to this, even pharmacists can customize the particular reporting system for him for his particular area. Likewise, in hospital setting also you can customize some method of the reporting as per your own convenience. But you must see that it should follow all the standards which are laid down by the regulatory authority of that particular country. So in most of the cases in the Indian system, we follow the format and we follow the system which is given by pharmacovigilance, the program of the India, and it is those formats are available on CDSCO website. So we'll be seeing that format in the detail, but still flexibility it is there. The pharmacist can design his individual format or the individual process for reporting of adverse drug reaction. Likewise, the hospital can also have their own process and the system for reporting of adverse drug reaction, right? In addition to this, the periodic publication can be utilized to keep staff member the inform about adverse drug reaction. So there must be the monthly bulletin or the monthly magazine which is coming on the adverse drug reaction. Likewise, there are many journals, they publish only paper on the adverse drug reaction. So if such publications which are coming periodically and the staff members of the hospitals or the physician or the pharmacist, if he is going through all those publications, then he is updated about the real-time information about adverse drug reaction of any newly medicine or any new adverse drug reaction of established medicine, right? So the periodic publication can be utilized to keep staff member informed of adverse drug reaction. So these are the different best practices that we can adopt to detect and to ensure the proper reporting of adverse drug reaction. Now in addition to that, we'll see what is the standard format for adverse drug reaction reporting. So this format, it is available on the CDSCO website and it is generally given by the Indian Pharmacopoeia Commission. So you can see here there are two important terms. One, it is the AMC, and second one, it is NCC. Now try to understand what is AMC and NCC first before going into the format. So the NCC, it is National Coordination Center. So National Coordination Center, there are many national coordination centers are present in the country. So what these centers are doing, they coordinate or collect information which is coming from different looks and corner of the country, and they compile the data and they then do the causality assessment. They do further study to confirm that ADR. So that is the National Coordination Center. Likewise, it is also called as the AMC, that is Adverse Drug Reaction Monitoring Center. Both things are same. The AMC and NCC both are same. These are the synonyms. It is called as Adverse Drug Reaction Monitoring Center, or it is also called as National Coordination Center. Okay, and these centers are run by Pharmacovigilance Program of the India. So I am talking about now Indian country, about our country. So it is run by Pharmacovigilance program of the India, Ministry of the Health and Family Welfare, Government of India, and their office, it is located in the Ghaziabad. Okay, so now this is about the basic background about the institute which monitor adverse drug reaction at the national level. Okay, now let's see what are the different aspects that you can report about the ADR whenever any event is happen in the patient and patient suffer from adverse drug reaction. So it consists of different parts. So first part, it is the patient information, where you can write the patient initials like Mr., Mrs., right? Likewise the age at the time of the event or the date of the birth. Likewise whether it is the patient is male, female, or maybe the transgender, so that you can mention. The weight is very important because sometimes ADRs are related to body weight. So you need to also mention the body weight of the patient. Then suspected adverse drug reaction, the date of reaction of that adverse drug reaction started. Maybe the patient taking the medicine from the 15 days, but ADR are started just from last 5 days. So that date must come. Then date of recovery from the ADR. Then describe reaction or the problem. What reaction the patient suffering from. For example, maybe the patient suffering from the adverse drug reactions to the penicillin, so he may be suffering from the skin rashes. So this could be one of the adverse drug reaction. Or maybe the patient blood pressure, it is increased. Patient suffer from hypertensive crisis. So that is also one of the adverse drug reaction. So that you can describe. So description of the reaction to the problem. So this is the 7 point. 8 point, it is the about the suspected medication, that as a physician or as a pharmacist, which medicine you suspect that ADR it is due to that particular medicine. So that those medicine you can just list out. Maybe patient taking 3-4 medicine together. So if the patient suffer from ADR, then you cannot write the name of only one medicine. Then in those case, you need to also enlist those medicine which are taken by the patient. So based on their previous history of the patient or the previous data of the drug, if some established ADR is there, then you can directly write the name of that particular medicine. So about that medicine, you need to write about the brand name and generic name. Then manufacturer, who is the manufacturer, because some of the ADR are related to the manufacturer formulation. If you just change the formulation, it may lead to the ADR. And just now I have mentioned about that the phenytoin, when one excipient it is changed by one of the manufacturer, the phenytoin toxicity is increased. Likewise, the batch number should come, experiment, that is the date if known, dose use, the route use, because some of the ADR they may be related to the route of the drug administration. Maybe patient does not suffer from ADR. If drug it could be given through the oral route, but since it is given through the IV, so he is suffering from the ADR. So that can also be reported. The frequency, once a day or twice a day, how many times that medicine was taken by the patient, therapy of the date of the start of the treatment, date of stop of that treatment was stopped, and the indication for which drug was given. Maybe the drug was given for the infection, like penicillin is given for the infection. Then in case of you are given another drug like diuretics, you might have given for the increase in blood pressure. So that indication should come. And at the end, what is the causality assessment? Have you established any relationship between the drug and the ADR? If that relationship is established, then up to what extent you have established, so that you can write in a causality assessment, right? So now this is related to the drug and establishment of the relationship between the drug and the adverse drug reaction. In addition to that, the next parameter, it is the action taken. What action you have taken after you come to know about that ADR, like you have withdrawn the drug, you have increased the dose, you have decreased the dose, or you have not changed the dose, or maybe you have not done anything, so it is not applicable. Likewise, if you don't know, like you are someone else, you are not treating that patient, but you heard about ADR from someone else. So if that is not known to you, you can just tick about not known to you, right? Likewise, the reaction reappearance after introduction, we have seen that in case of the detection of the ADR, there is one method that is called as the challenge and re-challenge. So if you want to confirm the adverse drug reaction, it is generally done in the hospital setting. Suppose the patient is reported with particular sign and symptom of the ADR, then what you are doing, next day again you are giving the same medicine to confirm that whether that ADR it is related to that particular drug. Okay, so it is called as the method of challenge and the re-challenge. So the reaction reappeared after reintroduction of the drug. So if yes, then you can just tick yes. If no, you can just say no, right? Then effect unknown or dose if reintroduced, so that also you can mention. Likewise, last part it is the commitment, concomitant medical product including self-medication and herbal remedies with the therapy which were given to that date where he was suffer from adverse drug reaction. So sometimes patient is on treatment with many coexisting medication. He is taking medicine for coexisting disorder. So those medicine or maybe herbal product or herbal drug he is taking, then that also you can write, so that the coordination center will come to know about any ADR which is related to drug or drug interaction or drug or food interaction. So these are total 11 points we have seen. The 12 point, it is the relevant test and laboratory data if it is done. 13 it is the relevant medical and medication history, like the patient having the history of the allergies. The race, we have seen it's play a very important role. He may be from particular ethnic group and he might be suffering from the adverse drug reaction, like we have seen in case of the Eskimos and the Jews. There is change in metabolism through the process of acetylation. Some are slow acetylator, some are the fast acetylator. Okay, so that also you can note down. Likewise, the patient has the pregnancy, or maybe he is the heavy smoker, or he is the heavy drinker, he drink alcohol. If those are the cases, then you can also mention about those things, right? Likewise, what is the seriousness of the ADR? So the most serious ADR, it is something where the patient die, right? So if there is the death, then you can mention about the date. Then life threatening, whether it is life threatening or the ADR was there but it was not life threatening, but patient need to be hospitalized or his hospitalization was prolonged. Then disability, likewise other parameter also you can mention. Then you can also write at the end about the outcome, whether patient is recovered or he is recovering, not recovered, or the ADL it is very fetal, which is not recoverable, right? Then recovered with the sequels or unknown. If that is the case, that also can be reported in adverse drug reaction. So once you fill this form can be sent to the AMC, that is the Adverse Drug Reaction Monitoring Center, or to the NCC, that is called National Coordination Center, or you can just email that form to the pvpi@ipcindia.net. So this is the email ID for Pharmacovigilance Program of the India, right? So I will be sharing this form in a detail with you, where they have also mentioned about who can report, where to report, then what to report. Sometimes as a pharmacist or as a physician, you are confused of what type of ADRs are to be reported, up to what extent of severity it can be reported. So that also it is given in the form. So I will be sharing this form with you. Maybe I will be giving the link of this form in the description box. So you can go through this in a detail, so that you will get idea about how these ADR can be reported. Okay, so this is about the method or the way of reporting adverse drug reactions. I will just give you a highlight of the form which is given by Pharmacovigilance Program of the India. Let's see about the role of pharmacists in preventing adverse drug reaction. So the most important role of pharmacist in the prevention of adverse drug reaction, it is detection of the common syndrome. He must identify what is that common syndrome patient is suffering from, which may be related to the adverse drug reaction. Okay, so pharmacists may reduce the likelihood of allergic and hypersensitivity reaction by asking the patient simple question like whether or not he has ever experienced allergic reaction to the drug. If he experiences any allergic reaction to the drug, then further what he can do, if the answer to the question, if it is yes, then pharmacist should do further inquiry. So he can inquire about type of adverse drug reaction or type of hypersensitivity reaction he suffered from, and the drug that supposedly induce it, right? Maybe like the example I have just quoted, maybe you can quote many other example, like the skin reaction exhibited by the patient in the past by drug like penicillin. So this is just one example. Likewise, if many allergic reactions are there, like diclofenac also produces a very severe allergic reaction in particular patient. So if that is the case, and if you report that just before patient going to the physician, if you give the history sheet of the patient, then physician will prescribe medicine according to his history sheet, which help in prevention of adverse drug reaction. So this is how you can help to prevent ADR. Now let's move on to the next part of today's session. Second part, it is the overdosage. So pharmacists can also prevent the ADR which are related to the overdose. So let's see how it can be possible. So pharmacists may prevent overdoses which may be result of the physician error. Sometimes what happens, the drug which is to be given for twice a day. So when he write the prescription, physician, how he write about twice a day? So he generally write about 101. Okay. So inadvertently or by mistake, instead of 101, if physician has written something like this, 111, then what it means? It means it is not a twice a day, the medicine has to be taken thrice a day. Okay. So when such prescriptions comes to your medical shop, then that prescription can be properly scrutinized. So you can scrutinize physician prescription and you see that the proper dosage of the medicine it is given to the patient. If at all, if you recognize any such the error in the prescription, that can be brought to the notice of the physician and that prescription can be corrected. So this is how you can able to avoid the adverse drug reaction which is related to the overdoses and which may be related to physician error. Okay, so this is one aspect. Second aspect is that the patient voluntary administration of certain drugs. So mostly it is seen in case of the sedative and hypnotics category of the drug. In order to get good sleep, the patient take more and more tablets. But taking more tablets of the sedative, it is not advisable because at the different level of depressions are there. So first level it is sedation, then hypnosis, then unconsciousness, and that is called as anesthesia, then coma and death of the patient. So if more tablets of sedative is being taken, that may be the life threatening to the patient, especially in case of hypnotic drug. Generally benzodiazepine are safe, but if benzodiazepine are not prescribed, then in those cases even the few more doses of hypnotic drugs or maybe the barbiturate are not good for the patient health. So what you can do, the patient voluntary administration of sedative drug can also be avoided. So to do this, the pharmacist should attempt to maintain amount of such product he dispense. So what he can do, instead of dispensing complete one strip, if you know that the patient having a habit of or the history of taking the more tablet of the sedative, then you can dispense the small amount of the doses. So if at once also the patient take, it does not produce any toxic effect. Okay, so that can be done. In addition to that, so whatever medicine you prescribe, the number of doses you are giving, it should not produce the toxic level, right? So this can be done. In addition to that, the two way of limiting such product are the requesting physician to limit prescription quantity. So what the psychologist can do, he can prescribe medicine just for a week or maybe for 15 days, and then he can call back that patient to give the fresh prescription, because generally the all sedative and hypnotic drugs are the prescription medicine. Those are not given without prescription, and that prescription should not be expired. Means if that prescription it is given for particular date, then those medicines should be purchased on that particular date only. Or otherwise, it may happen that today you have taken medicine and tomorrow to get more tablet, that patient may go to the medical shop and ask for the medicine. If that is the case, you can inquire whether you have already purchased medicine from somewhere else. If that is the case, you should not dispense the medicine. So you can request physician to limit prescription quantity. So you can dispense medicine to the extent which does not produce toxicity to the patient. Likewise, you can ask physician to increase the number of refill is possible. So what do you mean by refill? Refill means instead of giving medicine for complete month, the physician can give medicine just for a week. So 4 times he has to go back to the physician, he has to rewrite the prescription, and he has to redispense medicine by the pharmacist. So these approaches can be adopted to avoid the overdosage related toxicity which may happen in case of patient voluntary administration of important medicine like the sedative drug. Okay. Likewise, you can involve in patient monitoring and counseling. It can be focused toward careful monitoring of the sign and symptom of adverse drug reaction. So you keep on watching or conducting active surveillance where you can able to recognize different sign and symptom of adverse drug reaction. So very good example, if patient on daily diuretic treatment, so maybe for hypertension to reduce the blood pressure, the patient was given with the diuretic drug. If the patient on the daily diuretic treatment, if it's come to you and if you are his family pharmacist, and if he may sometime call you and say that I am on the treatment of this medicine and I am suffering from so and so symptom, like in case of daily diuretic treatment, if he experience the weakness and fatigue, so this is very common. And why it happen? Because along with the increase in a urinary output, there is also loss of the electrolyte. And due to this loss of electrolyte, patient experience weakness and the fatigue. So if that is the case, then as a pharmacist, you can give solution to the patient. So the pharmacist should suggest supplemental potassium therapy for those patients who experience weakness and fatigue to the diuretic treatment. Or maybe if diuretic is prescribed for long period of time, then you can give this supplement or you can dispense this supplement of the potassium when the patient comes to you for refilling the diuretic medication. Okay, so such small type of monitoring and counseling of the patient can help to solve the ADR related problem which were seen in the patient. So the patient monitoring and the counseling, it's play a very important role in detection and also prevention of adverse drug reaction. Likewise, you can keep the patient drug profile record. So generally nowadays in the medical shop or in the hospital, softwares are available where you are keeping the history of the patient, right? So the patient profile or the complete family health record can also be maintained by the pharmacist. So if you have the patient profile about the complete history about what medicine he has purchased from last many days from your medical shop, and if any ADR is reported, then that can be also added. Likewise, if any allergy is reported, that can also be added in that particular software. So this can be maintained, and if you have this complete profile, then it will help you as a pharmacist in controlling adverse drug reactions. So you can easily recognize ADR if any that patient may suffer from due to the particular prescription given by the physician. Okay, so the patient drug profile record, it is also very important in monitoring of adverse drug reaction. It also helps pharmacists to make accurate prediction of potential ADR and the drug interaction. Okay, so this is how you can maintain patient drug profile record and avoid the adverse drug reaction, right? Lastly, the other prophylactic measure can also be adopted. For example, you can use the alert card for those drugs with high incidence of adverse drug reaction. Like for example, in case of the warfarin having the low therapeutic index and it produces adverse drug reaction. And there are many drug-drug interactions related to warfarin. So in such case, you can issue alert card to the patient. So patient having that card where it is mentioned that he is under treatment with the warfarin, he is taking so and so dose of the warfarin. So whenever he is that patient going to the physician for the treatment of maybe another disease, then in that case that card can be shown to that particular physician. So once he see that card, he is alerted and he will not give the drug which having drug interaction with the warfarin. So that is called as the alert card. So you can just Google out and search for the alert card. Due to copyright issue, I have not put the image of the alert card on the slide deck. Okay. So admission questionnaires, in addition to that, you can have the proper admission questionnaire regarding the drug allergies. So generally this is there and it is available in the hospital. So in hospital, when you are doing the admission of the patient, at that time the proper questions it is asked to the patient and proper history is being taken, which help to recognize any drug allergy to the patient, and that can be prevented in that particular patient. So this could be possible. In addition to that, as I have mentioned, the reference to published data or the publication can be of great assistance to the pharmacist. So you can keep on updating your knowledge about the published data about the adverse drug reactions to update your knowledge and which help you to prevent and recognize adverse drug reaction. And this is the last slide where pharmacist or in a hospital who is working in a hospital or maybe as a community pharmacist, you can perform different services which are related to detection, prevention and reporting of the ADR. Let's see what are those services. So these services, it including the patient interview. You can conduct the patient interview at a different point like in hospital before admission. If you are community pharmacist, so that when that patient coming to your shop for purchasing the medicine, that time also you can conduct short interview if you feel that if it is necessary for that particular prescription. Okay, so the patient interview, then daily visit to the nursing unit to the discuss possible and reported adverse drug reaction. Likewise, recognize potential of ADR based on patient history of hypertension, because many a time the patient suffer from adverse drug reaction if he having the hypertension. We have seen the many drug they produces hypertensive crisis, right? So if is there any recognized potential of ADR is there based on patient history of hypertension, then that also can be recognized, right? Likewise, you can identify cause of ADR based on patient description. So if patient comes to you and if he describes you about the adverse drug reaction, then you can try to identify what is the cause of adverse drug reaction. So these are the different services. Lastly, you can also see any withdrawal symptom of is there in the patient, right? For example, if the patient suddenly withdraw any particular medication, especially the psychological medicine or the medicine which are given for the treatment of the depression, psychosis, if those medicines are suddenly withdraw, then patients suffer from withdrawal symptoms. So those are also called as adverse drug reaction. If that is the case, then pharmacists must able to involve in determining the withdrawal symptoms which are related to particular medicine. So these are different services you can perform as a pharmacist to detect, prevent and also for the proper reporting of adverse drug reaction. So I have done with my today's session. I have referred these two textbooks to gather the content of the today's session. The Roger and Walker and Kat Vitlesia, then Dr. H.P. Tipnis and Dr. Amrita Bajaj. And that form that we have seen which are related to adverse drug reaction reporting form, it was downloaded from the cdesco.government.in website. So it is already available. If you follow this link, you will also get this. So thanks for watching my session. For more such learning, subscribe to my channel. And if you like my session, then do remember to give me a thumbs up.